Our lecture today is about renal and urinary symptoms. So what is the function of the kidney? Normally, the kidney is responsible for the excretion of toxins from the body and the production of urine, which is the end product of the kidney function. The kidney is also responsible for maintenance and regulation of the acid-base balance of the body. The kidney has some hemopoietic function through the secretion of erythropoietin, which is an hormone. It is a hormone responsible for erythropoiesis. The kidney also has some endocrinal function. What is the clinical presentation in cases with kidney disease? First, when the renal excretory function is disturbed, there will be fluid retention. Fluid retention in renal disease will accumulate in the face, especially around the eye, resulting in puffy eyes and swollen face. There may be edema of the lower limb and decrease in the urine output. When the fluid retention occurs, too much fluid retention occurs. In severe cases, there will be shortness of breath due to accumulation of fluid in the pleura and generalized arthralgia, which means accumulation of the fluid in different serous sacs like the pericardium, the pleura, the peritoneum, resulting in ascites. Sometimes the fluid is retained in the alveoli, resulting in what is known as pulmonary edema. So instead of having air in the alveoli and maintaining the diffusion process of the exchange process of carbon dioxide and oxygen, fluid will be accumulated inside the alveoli and will interfere with this exchange process. The excretory function of the kidney includes also retention of toxins and products of metabolites like ammonia, urea, uric acid, and creatinine. Ammonia is excreted through the breath, resulting in bad odor of the breath as ammonia smell. Urea also is excreted in sweat instead of being secreted in urine, and so when the water evaporates, the urea will precipitate on the skin, giving rise to what is known as urea frost. When the disturbance occurs in the acid base, there will be metabolic acidosis. So renal failure is one of the causes of metabolic acidosis. Metabolic acidosis has many signs like change in the conscious level, confusion, and increasing drowsiness, cosmal respiration, which is acidotic breathing. It is a compensatory hyperventilation to excrete much carbon dioxide to compensate for metabolic acidosis. Other signs including hyperkalemia, headache, muscle twitches, nausea, and vomiting. For the hemopoietic function, disturbance of hemopoietic function and decreased erythropoietin production will result in anemia. The kidney is responsible for the excretion of renin. When the kidney function is disturbed, there will be increased excretion of renin, which through a special process will result in salt retention, in vasoconstriction, and increased excretion of aldosterone from the suprarenal, and the net result will be hypertension. So what is the clinical presentation related to micturition and urine output? The amount of urine normally is about 2 liters per day. When this amount increases more than 2 liters, this is known as polyuria. And when the amount is less than 500 milli per day, this is oliguria. Anuria means total suppression of urine less than 100 milli per day. For the color, the normal yellow color of the urine. Sometimes it is replaced by a red color of the urine. Red coloration of the urine may be due to excretion of hemoglobin. This is known as hemoglobinuria, or the presence of RBCs in urine. This is known as hematuria. Dysuria means painful micturition, and it is a sign of urinary tract infection. Frequency. So repeated urine output, increasing frequency of micturition. This may be associated with voiding of a large amount of urine, which is known as polyuria, or in some cases associated with urinary tract infection, the amount of urine is small and the condition is usually associated with dysuria, with painful micturition in urinary tract infection. What are the systemic manifestations of chronic kidney disease? When the kidney fails, there will be some cutaneous manifestation. The skin will be pale due to the presence of anemia and yellow due to retention of urochrome pigment. There will be dryness of the skin, bruises, itching, urea frost, and sometimes we have this sign in the second picture here. We have half and half nail. There is proximal white nail and distal dark brown nail. For the cardiovascular manifestation, hypertension is one of the signs of kidney failure. Hypertension may be related to the hormonal disturbance and increased renin, as we just mentioned, or there may be fluid overload as a part of or as a cause of hypertension. The pericardium, sometimes there is pericardial inflammation known as uremic pericarditis, and sometimes this is wet, resulting in pericardial infusion, and sometimes accumulation of bloody pericardial effusion. If it is large amount, it is known as cardiac tamponade. For the respiratory manifestation, sometimes we have acidotic breathing or cosmal breathing, pleural effusion, recurrent infection, and inflammation of the pleura or pleurisy. Nausea and vomiting is very common in patients with renal failure. Persistent vomiting is one of the symptoms commonly encountered in this patient. High cough, bad smell, ammonia-like smell, gastrointestinal hemorrhage, and coated tongue. Neuromuscular manifestation include extreme muscle fatigue, wasting, bone aches, and deformities, especially in children, headache. Sometimes the patient presents with drowsiness and coma. This figure illustrates or summarize the signs and symptoms of the kidney disease. For the investigations, we have at first biochemical investigation, including examination of urine, tests for kidney function, some microbiological and immunological tests that can help in diagnosis. For the urine analysis is a simple test for the kidney function. This includes the physical examination for the volume, for the color, for odor, for specific gravity and reaction, the pH of the urine, microscopic test for the cells and crystals and cast, biochemical examination for proteins, sugar, ketone bodies, and others. Nowadays, we have this bedside urinary dipstick, which can detect the changes in urine, in a sample of urine, just by introducing this strip in urine and detecting the color change. Urine abnormalities may include proteinuria. So normally we have less than 150 milligram in 24-hour protein in urine. So when we have protein in urine This may be very little protein known as microalbuminuria. When the protein increase, we have mild proteinuria less than 1 gram per day, up to nephrotic range proteinuria, which means the presence of more than 3.5 gram per day protein per day in urine. Hematuria may result in change in the color of urine. This is macroscopic hematuria, so the blood is visible in urine and the urine color is red. And sometimes it is microscopic, so it is just detected by the microscope. So, what are the causes of macroscopic hematuria? Mostly these are surgical causes, including renal stones, malignancy, infection, glomerulonephritis may result in hematuria, stones in the ureter, bladder infection or malignancy, prostatic hypertrophy or malignancy. Renal function test. First, we test for the glomerular function by using the serum creatinine. This is routinely used and it is the best indicator for the kidney function. Normally, it is less than 1.2 milligram per deciliter. Plasma urea and blood urea nitrogen are other tests for glomerular function. GFR or glomerular rate, it's one of the tests done for kidney function. It is done by estimation from the serum creatinine using special equation, or sometimes it is done quantitatively in 24-hour urine output. In acute kidney injury, there is a rapid deterioration of the kidney function. Chronic kidney disease, the deterioration is very gradual and it is maintained for more than 3 months. The stages of CKD is classified according to the GFR. So we have 5 stages according to the glomerular filtration rate. The 5th stage is the stage of end-stage kidney disease when the GFR is less than 15. Other investigations include radiological examination of the kidney and renal biopsy. Sometimes we have more than one feature of kidney. These features are combination of common symptoms of kidney disease as high blood pressure, dipstick abnormalities, starting from mild proteinuria to nephrotic range proteinuria, which means more than 3.5 gram, hematuria, changes in the GFR, and impairment of the kidney function. We have what's known as nephrotic syndrome and nephritic syndrome, which are actually collection of symptoms and signs. So what is nephrotic syndrome? Nephrotic syndrome is the presence of proteinuria, hypoalbuminemia, edema, and hyperlipidemia. The protein loss here in urine is more than 3.5 gram per day. Nephritic syndrome is the presence of these 5 items: hematuria, proteinuria, hypertension, renal impairment, and oliguria. The urine output is usually less than 400 ml. Chronic kidney failure because of the presence of anemia and because the kidneys are small size. Thank you.